I spent the last 3 days, Vonda Wright also talks about Echolight, which is a new technology for ultrasound to measure bone density and also bone infrastructure. But our bone health, because the third thing that we tend to suffer from later in life is fractures. And 1 out of 6 of us will have a hip fracture, and 50% of those women will never be independent again. So that's not a happy situation. And 20% of them may have significant morbidity or mortality afterwards, meaning they might die within the first year. So we have to figure out what our bone health is, because during menopause, 1 to 2% of our bone mass we lose within the first 10 years, and we can lose up to 20% of our bone mass. So why should we wait till we're 65 when insurance pays for a DEXA scan to tell us that we need to be on more vitamin D, we need to increase our muscle mass, that we need to be working on our bone density? We should be able to have that information earlier, and especially if we're osteoporotic, there's medicines and alternative treatments that we can use. So there are very cheap places that you can get a bone density scan, which basically is a 2-dimensional X-ray that is going to tell you that density, like how heavy your bones are. But what it doesn't tell you is your infrastructure. So you could have a brick house that'll blow down in a storm, but it's very dense. Or you could have a bamboo house made of very light bamboo sticks, and it'll stay up because of the infrastructure. So this new ultrasound technology actually measures both of those and tells you your risk of fracturing in the future. And that's one thing that I'd like everyone to think about. When you go into a test, a mammogram or a pap or a DEXA scan, ask yourself, why am I doing this? What is the purpose? And then when you go into that DEXA scan, you want to know, am I going to fracture later in life? Is this the best test for me to know this? And what am I going to do with it afterwards?
And I would love to hear from you, Tiana.